So Dr. Brinda is going to present on, what's that? Prescribe. Do it yourself ELog Atlas for PGs and the fellows.
Good afternoon, everybody. We all know logbooks are the integral part of PG residency, but traditionally we use written logbooks. But a written logbook has legibility issues and limited storage, limited search option, and it is inconvenient to update and difficult to share. So, in many institutes, we are using e-logbook. Converting into an e-logbook has improved the accuracy of and efficient data entry is possible. There is search functionality as well as automatic backup security and privacy is possible. And it is easier to share, especially in remote access. In ophthalmology, it relies heavily on the visual diagnostics. For an ophthalmic resident, it is very crucial to remember and interpret the images we come across in the OPD as well as camps. So that is how we attempted to revamp the traditional logbook approach to encompass clinical photograph with a concise summary of the case that we come across in OPD and camps. Initially, we used to take photograph with our smartphone, and later on, when we were used with the slit lamp, we collected images from the imaging system attached to the slit lamp, and also we used smartphone adapter to connect to the eyepiece of the slit lamp to get the images. And fundus images were collected from the fundus imaging system in our hospital. And in community outreach program, we used a 3D printed anterior segment as well as posterior segment imaging system and smartphone based fundus cameras. And later on, we have a discussion with our consultant, and these were added into simple digital platforms like Microsoft PowerPoint. And we added annotation to improve the image. I would like to invite your attention to few pages of atlas we have created. Later on, we used to collect images even from the OT. We collected the pathological images from the lab associated with. Once the number were increasing, we divided it into anterior segment as well as posterior segment. For an easy access, we thought of developing a web app. We named it as Prescreyebe. We can log into the web app by making our account with the name, email ID, phone number, and selecting whether resident or a consultant. On the home page, we are able to see all the cases we have uploaded so far. On the left-hand side, we will be provided with all the specialties. And clicking onto a particular specialty, we'll go into all the cases that have been uploaded under that particular specialty. And we can add a new case. On the MyAtlas platform, we can see all the cases we have, the person has been uploaded. And on the right-hand side, for that particular cases we have added, we will be provided with edit option as well as a view option. We can add a new case by clicking on the add new option. We have to add the name, EMR number, and short summary with diagnosis. We have to select the specialty so that it will go into the particular specialty. We can add media from our gallery, and we have to save it. Once it is saved, on the bottom side there is a comment option where our consultants or mentor can comment. And on the left hand side top, there is an export PDF option. We can take a PDF of the same and we can save it, and we can even take printout of the same whenever we need to present it for our Viva or exams. So converting a written logbook to an ELog atlas have encouraged our active learning, improved retention and recall, supported collaborative learning. It acted as a potential tool in our OSCEs and Vivas, and it facilitated objective assessment and feedback for the consultants also. So considering an ELog atlas logbook will be can beautifully merge the precision of a logbook with the richness of atlas. These are my references. Thank you.
Very nice. So is this a private logbook or is it shared between residents?
Shared between residents, sir, within the hospital. Consultants.
Because when you had a physical logbook, if you attended 10 cataract surgeries or 20 cataract surgeries, that was recorded as your attendance.
Yes.
Here, if everyone is going to contribute pictures, you have the person who has clicked the picture's name.
Yes. We can see the picture, but only for that person who have uploaded it, we can only take a printout or convert to PDF or edit the option. Others can only comment.
They can see it.
They can see it
and
view
comment.
option is up.
But it remains your
Yes.
atlas.
I think it's customized to each and everybody. Yeah.
Okay.
Same patient is seen by another doctor and he also uploads, then that becomes his image.
We upload after the discussing with the consultants only. After final.
Okay, thank you.
Thank you.